My name is Clarke. I'm a GP in Ilkley and I'm Chief Exec of WACA, which is a GP federation. We represent about 74,000 patients within Airedale, Wharfdale and Craven. We work very closely with our colleagues in modality. Both myself and my modality colleagues, we sit on the Provider Alliance meeting here at Airedale Hospital. So today I'm going to talk about our most recent meeting, give a breakdown of what we talked about, and obviously trying to do as good a job as Brendan did in his first one last month as well. So one of the first things we discussed at the meeting was the A&E delivery board's sort of breakdown of the recent the winter review. We all agreed across all partners that it has been a challenging period over the winter. We think we do sort of see some benefits in terms of collaborative working and working as a system, and I think it means that we've got learning we can take forward to the next winter, and hopefully next winter we can be more resilient going forward. Really, it's definitely an ongoing process. Some members of the Provider Alliance, so there's Karen Gelosso from the CCG, Kath Gregson who works here at Airedale Trust, and myself as part of WACA. We've been taking part in an NHSI funded scheme called Transformational Change and System Leadership. So this is three two-day courses that have been held in Leicester. So we've had the first two lots of 2 days in Leicester, which have been really, really helpful, and it kind of feeds really neatly into the work we're doing within the system in terms of care coordination. Care coordination is a massive area. Most of us, as part of our day-to-day jobs, do care coordination anyway, but often we don't call it that. So there's lots of work looking at trying to identify cohorts that we feel could really benefit from care coordination, and obviously we'll be reporting back in due course as we move things forward. But it's very much an ongoing sort of project, and see lots of things happening there potentially. So Karen Gelosso also presented the intermediate care audit, which has recently been done by the CCG, looking at sort of admissions to hospital and whether any of these admissions potentially could have been avoided or managed differently. Interestingly, she showed that there's about 12 patients per week, which is obviously 48 patients a month, that potentially could have been managed differently and may not have necessarily had to be admitted to hospital. I think we all sort of felt there's a real sort of opportunity there at trying to identify these particular patients that may not need to be in hospital in the first place, and looking at ways of doing things differently. I mean, this kind of potentially feeds into the care coordination piece that we talked about earlier as well. So again, it's just trying to sort of very much work in progress and how we can move that forward. One of the other things we talked about was the new GP contract. For people that don't know, this is recently the NHSE and the BMA negotiated a new GP contract. This is due to be live from the 1st of July, and it's quite a big change from what we've had over the previous years in terms of contract changes. The last major contract change that GPs had was in 2004, and sort of in the meantime there's been lots of sort of tweaks and minor changes. This is quite a sort of a major shift in how the system sort of views general practice and primary care. The contract itself is a real positive for primary care. It means that part of the contract involves GPs forming themselves into networks. Locally, we've been very fortunate in that ourselves as WACA and modality are already sort of working really closely together, and also working as sort of self-functioning providers really, which is a real plus. We're hoping to continue in those same forms in terms of forming our GP networks, but throughout the whole process we've fully committed to supporting the 3 communities that are already existing within the AWC locality as well. Again, it's very much work in progress. We're still waiting for some more clarity from NHSE in terms of how the contract might look and how it's going to work, but throughout the whole process, ourselves and modality have said that we fully support the 3 communities that are in place, and we want to work very closely with them going forward. So along the lines of the 3 communities, we also talked about looking after our neighbours campaign, which is a sort of a locally driven campaign, just really to get people to look out for people around them really, and I suppose be more sort of socially aware and aware of other people's needs around them. The aim is to try and reduce loneliness and sort of support people more in the community. So again, it's something just to be aware of really, and a really positive thing for our local patients and the community really. Okay, so that's it for me today. If you want to follow us on Twitter, you can look for us on the AWC Provider Alliance. Okay, thanks.